Right now, though, I want to cut what's going on at Queen's Park, because we carried the announcement, I guess, about a week or so ago, when long-term care minister Paul Calandra was talking about some of the changes they're going to make to try to alleviate the pressure in hospitals. Well, now we find out the Ford government is trying to move this controversial measure to move patients into long-term care without consent directly into third reading, which means there will be no public consultation, which means there will be no delegations. Nobody's going to be able to go before the ministers and talk about this. That's somewhat problematic, right? Well, here's what the minister had to say.
Are there instances where hospitals will be charging? Absolutely. If somebody refuses to move into a home, if they refuse to move into their home of preferred choice, then yes.
Yeah, pretty shocking, right? Well, Liberal MP Dr. Amir Shanji characterized the move this way.
That is coercion, and that is fundamentally wrong.
I think that's echoing the sentiments of an awful lot of people. We'll use that one to kick off our weekly segment with John Best, the publisher of the Bay Observer, who joins us every Friday to talk about things political at the provincial and municipal levels especially. John, welcome back to the show.
Good to be with you, Bill.
We knew that, it's a majority government, and that gives these guys mandates to move forward on some legislation, even if it might be controversial. But this one, I think, is catching a lot of people off guard. And I guess maybe the thing most controversial about this is the way that they're characterizing what might happen to some of these people to move out, but even more so that they're going to break the third reading, which essentially means we don't want to hear from the public on this. We're just going to ram this through.
Well, this is the kind of measure that a government introduces when they're at the very beginning of a term, because obviously it's going to be hugely unpopular with the people affected. They're skipping, and they know it is so grossly unpopular that I think they figure they've got very little to lose by removing the nicety of going through a hearing process. They know it's ugly, and so they're just going to bull ahead with it. Now, whether at the end of the day we see, I can't imagine a senior on guaranteed income supplement. There's no point. I mean, yes, they could charge them $1,500 a day, but they're not going to get it. That's what a senior in that position, almost what they get in a month. So I think there's a bit of saber rattling here, but I think it's clear this is a measure that the government feels it has to take. And I also think that this did not just pop up since the election. I think this is something that they've been hearing from maybe the Ontario Hospital Association. This looks like it's too well formed to be something that was just dreamed up in the last couple of months. So I think it was one of these things where they say, let's get the election out of the way, and then we're going to take some what will certainly be seen as fairly drastic measures.
And listen, and I agree that, they didn't just throw this on the back of an envelope the day after the election. This has probably been in the works for some time. And there is indeed a crisis. I mean, we'd be naive not to suggest that. I mean, the story in Hamilton today that I guess it's Hamilton Health Sciences has just commandeered a number of hotel rooms in downtown Hamilton and offloading some patients to there. So, I mean, we understand that this is a crisis situation right now. But when you get to the point where you're simply going into a senior in a hospital and say you're moving, and by the way, you're moving from Hamilton to St. Catharines or something, and as you say, I mean, we're not even sure how far away some of these are going to be. And if you don't go, we're going to start charging you. It's technically what the minister said. Yeah, we're not going to make the move, but you're putting a lot of pressure on them to get out of bed, basically, and get out of there.
Yeah, there's no way of sugarcoating it, Bill. It's ugly, but this is the sort of blunt end of when you hear the phrase triage. It's normally thought about in terms of where they try to assess whose needs are the greatest, and we go there first. And it's a term that came out of the battlefield originally. But there is a terrible crisis, and I guess the question is, if you've got someone who can't get through an emergency room into a hospital bed, somebody who's critically injured or severely suffering from cardiac problems or whatever, and there's this backlog, and you're trying to assess that against the unwillingness of someone to move to a long-term care bed, it's a tough, miserable decision, but given that our hospital system is in the condition it's in, I mean, it could be argued we should have had a better system, we should have spent more money, we should have seen this coming, but here we are, and we don't have adequate means of moving people around and getting the most efficiency out of these hospitals. So it's ugly, it's miserable, and at the end of the day, let's see how much of it, as you pointed out, in Hamilton, I think it's going to have more effect, frankly, in smaller communities and northern communities. You get into a place like Hamilton, where we already had a hotel that had been taken over for the COVID crisis. It's already fitted out in a hospital, with hospital beds, hospital setting. So our solution in Hamilton may be no more than simply moving people there. But if you're in St. Mary's or, Owen Sound or someplace like that, then you could see people getting moved further away.
I guess the other concern, and I've heard this from a number of people over the last couple of days that are opining on this, is, the alternative here is, as you say, move them into long-term care facilities. That they've got their own set of problems. I mean, we know that there's overcrowding, understaffing there. There's a lot of concerns about the living conditions in some of these facilities too. It's not really the best option for some of these people, I would think, but it's the only option that they're presenting right now.
Well, I was looking at the long-term care ministry's news releases while I was waiting to do this with you, and they haven't issued a news release since April. But back in April, they were talking about creating something like 30,000 beds. So whether that got lost in the election, I'm not sure. But let's face it, we keep talking about beds, and that it's such a misnomer because it obviously isn't a bed. It's the staffing to look after that individual, and I guess what it really comes down to, that if you take a person who really should be in a long-term care setting out of a hospital, they're moved to a setting where they don't need as much care, and therefore nursing staff can be spread over more patients. I think that's really what it comes down to. It's almost like a widget factory in a sense, where your time and motion studies almost come into play.
The concern, of course, for anybody who had loved ones or has loved ones in some of these facilities, you're absolutely right. The level of care is not going to be the same, and probably not needed to be the same as it would be in a primary care, in other words, in a hospital. But oftentimes it's family members that fill that gap. They visit every day. They help with feeding or lunching or going for a walk or something like that. You move somebody 30, 40 kilometers away, it's problematic for them to actually do that. And the isolation and the resulting things that can happen from a psychological standpoint can be problematic. And I know we're kind of playing it into the hypothetical, but we've seen that happen in the past, and I don't know that they've thought that far ahead.
I think they have thought it that far ahead, but I don't think they see an option. I really believe the system is really in crisis, Bill. I think that's one area where almost everybody would agree, and the fixes are simply not able. You can't implement them quickly enough to provide the kind of solution people would like to see. There was a very interesting interview on the national broadcaster, I'll say, a couple of weeks ago, where a very senior health expert, who's a teacher, said that in her view, the people that are running the system now are not the people probably who should be devising improvements, because they're simply too exhausted after going through 2 years of COVID and really being just in a flat-out crisis mode, that it probably requires somebody who hasn't been in the midst of that to try to come up with some answers. And it's not just money. I think we talked about this. The United States, on a percentage of GDP, spend almost double. They certainly spend double what we spend, but what we're spending is more in line with what Germany, France, Holland, all the other G7 countries. So we seem to be spending an amount that is commensurate with what most of the Western nations are spending. The Americans are just blowing money out the door, and I don't think anybody would suggest that their system is the one we should be emulating. And yet, if you look at Germany, you look at France, you look at Denmark and some of these places, they seem to have smoothed it out better than we have, and they're not spending a lot more money than we are. So there are solutions available, but switching to those solutions is always going to cause some pain, I think.
Yeah, and there's just, I think, almost a typical human reaction to resist change. It's uncomfortable for an awful lot of people. We'll see. One other piece, got a couple of minutes left, one other piece of legislation where they actually have decided to have hearings on was this strong mayor's business. And I know you and I talked briefly about that last week. But it's moving into situations now where it's going to be going into the legislature in first, second, third reading. And it's a majority government. I mean, it's going to pass, we know that. But the line of questioning that some of the opposition MPPs had for the minister yesterday was interesting. The bill, as you know, John, is called the Strong Mayors Building Homes Act. And the theme of the questioning seemed to be, what does one have to do with the other? There's not very much, if any, mention about building homes in this act. It's really just to give the mayor more powers. And the concern there is, how is that necessarily going to mean, we're going to build more houses? There's a bit of a disconnect there at the same time, but I guess that's typical in politics, isn't it? I mean, you wordsmith a little bit to try to make the bill look more attractive.
Well, exactly, and in the case of the housing crisis, and there's no question there is a huge backlog of applications to build houses, and so there's it's being described as red tape, and to some degree it is. But the real problem, certainly, I've talked to people involved in planning locally. The biggest problem we're facing right now in the province of Ontario with these approvals is there's just a tremendous shortage of planners. So we're back into a personnel shortage. It's like the hospitals. Planners are very hard to find. And in the case of Hamilton, they asked staff generally, once the COVID started to reduce, they said, well, folks, can you come back 3 days a week? And what happened in Hamilton, and certainly in the planning department, was a mass resignation, because they can get jobs anywhere, and they can get jobs with jurisdictions that will allow them to do it remotely. So you need planning staff, or you just say to hell with it. We're just not going to bother with planning, and we'll just rubber stamp these applications, and we'll have houses, 25-story apartment buildings and houses in people's driveways and all of that. But certainly one of the biggest problems, once again, it comes back to people. There, is the shortage of planning expertise.
I got a minute left here. Are you comfortable with the one element here that a lot of people have raised with the strong mayor itself, is giving the mayor the power to essentially hire staff? Could hire the city manager, could hire all the department heads, or fire them, as the case might be, as opposed to council voting on that and these sorts of things. Is that going in the right direction?
Well, right now, council doesn't vote on any of that either. So, they basically hire the city manager, and the city manager handles all of that. That part of it, I think, has some merit, although we're dealing with human beings, and there will be mayors who will become, who will misuse that power. I think it's fair to say with 444 municipalities in Ontario, we're going to find some mayors that will, if it was extended. Now, in fairness, it looks like it's only going to be extended to the large cities, but still, you could get, you look at Brampton with Patrick Brown. I mean, he was accused of hiring a bunch of toadies from Niagara who had been disgraced in their municipal offices there. So you could get situations where you're going to have a real mess on your hands. But on principle, I like the idea of the mayor being able to have key people in key positions. I think that's probably a good thing.
Well, that one's moving along too, so that's going to be, and will be in place, by the way, by the time the municipal elections roll around October 24th. And as you mentioned, Toronto and Ottawa will be on the first round of that, and we'll see how that works out. As always, John, thanks so much for the time. Have a great weekend, and we'll talk again in a few days.
My pleasure, Bill.
John Best, publisher of the Bay Observer. Quick break, and then we're back. This is the Bill Kelly Show.